Chairman. Ladies and gentlemen, after this little break, this coffee break, I shall give you a little talk about how your carbohydrate metabolism is influenced by the depleted water, the deuterium depleted water. So these things came into our focus because the first time they realized that if a patient was treated with the DDW, the deuterium depleted water, somehow the diabetic patient has a little bit lower sugar level. So they needed less insulin. And the physicians are aware that if somebody is coming, they are asking all the time whether they are ingesting or some kind is treated with the deuterium water or not. So this is why we started to ask the question, is there any effect on the carbohydrate metabolism or not? So let's test this one. So first of all, we had to choose some kind of animal model. I have to leave it this animal model to test this diabetes. There are two types of diabetes. The main type of diabetes, as you know, there's a type 1, this is the insulin-dependent diabetes, and another one is type 2 that usually affecting the elderly patient. And of course, that would be much more interesting, the type 2. However, it's more difficult to have an animal model. So this is why we focused on animal model, the first type. And we induced the diabetes on the rat. And this is an antibiotic that can somehow immunogenically destroy the beta cells, the pancreatic beta cells, and causes a diabetes of the mouse. And we tested how the DDW affecting the carbohydrate metabolism of these animals. The first thing that we wanted to see is any effect or not. This is how we shall start it, because if it's no effect after, we don't need to talk about anything. So, but let's see, my talk is a little bit longer, so for sure there is some result. So let's see what we did. First of all, we induced the diabetes. We administered this streptozotocin to the animals, and after 2 weeks, we checked the blood sugar of the animals, and of course, it went up to the sky. Normally, the animals has around 5 millimole of sugar as a normal one, and normal people, and now it went up to 60 or 40. So that can induce, for example, a human. It's a nice ketogenic reaction of coma. And after we started to administer all the tap water, this tap water is 150 ppm of the deuterium it has, and another group of animals received less deuterium containing drinking water. And after we checked the 2 weeks and the 4th week, we checked the following parameters. We checked the glucose level, the serum glucose level, the fructosamine, and the hemoglobin 1AC level. As you know that as long as we have a glucose metabolism, this can, let's say, glycolate the proteins, and that will cause the eye effect and the glomerular effect, the kidney problems, and another side effect of the diabetes usually is correlated with this long-term effect of the glucose metabolism. And we check the urine as well for the glucose, protein, and the creatinine. Now let's see what we got for the first, let's see, gunshot experiment where they did. So first of all, this is a control value that we do have. Animals has a very low level of the sugar. It's about, let's see, there's a 7.1. These are not fasting blood glucose level. This what we have. If we didn't have any kind of insulin treatment in these animals, of course the sugar level was very high in these animals. Now, after we wanted to test whether the deuterium, if we deplete the deuterium, this alone can affect the sugar level or not. As you see here, there's no effect. So itself, if you decrease the deuterium or if you influence the deuterium content of the water, there's no effect on the sugar level. However, if we started to add insulin, so when we started to induce somehow the glucose metabolism in the body, this depletion of the deuterium somehow potentiated, let's see, the glucose uptake. So these animals had lower glucose level, whoever received insulin. And measuring the fructosamine, this is a fructosamine, this is an albumin part that is glycated. You can see that together with insulin, that is much less comparing to, let's see, the other group, and very similar to the hemoglobin 1AC level. Again, it's much lower comparing to the tap water. So it meaning that this depletion only affected the insulinic effect. So somehow interfere with the insulinic effect. That's okay, because in type 2 diabetes, the patient does have insulin. However, the problem is the insulin cannot affect on the target tissue because it has resistance. Now, let's continue this and let's see is that this effect is dose dependent or not. This should be dose dependent if some kind of correlation to the mechanism. And another one, what is the underlying mechanism? Because without any mechanism, we cannot sell the story. Now what we did, we repeated a very similar setup, except we used different groups in different doses of the deuterium. We went from 25 to up to 150, and we do have increased, let's see, the dose is 5 ppm, so it was very precisely set up. And we again measured very similar parameters. Now let's see how the blood glucose level changed if we changed the deuterium content of the drinking water. As you see here, this is the ppm, this increases, so that's a tap water. When we started to withdraw the deuterium, somehow the glucose level, the animal received the same amount of insulin, every animal, but they received different different dose of the deuterium. So as you see that at the beginning it rapidly affected the glucose uptake, and after it's reached, let's see, a steady state, but it looks like has an optimum of this curve, and this optimum was about 130, 135 ppm. The fructosamine level, very similarly, it looks like as an optimum curve, and this very similarly, it was about 130, 135. And if we check the hemoglobin A1C level, very similarly, not the lowest doses, not the highest dose, but around 100, 135, it was the optimum of this concentration.